So today we're going to be doing IV piggyback tubing. So I'm going to be in the med room first. So the first thing I want to do is verify the order that we have for the patient. So I want to do the 5 rights: the right patient, the right medication, the right dose, the right time, and the right route. And then I want to make sure that what's ordered is correct. So I want to look in the pediatric dosage handbook, make sure that the safe dose range that has been ordered is correct. I can also find the dilution that the med may need to be diluted in by taking the dose and dividing that by the final max concentration. Also want to make sure that the patient isn't allergic to what's been ordered before I even go in there. And so once that's all set, I'm going to grab the med from the med room. I want to make sure that the bag is labeled as well as the tubing. So I want to make sure that the medication name, the date, time, and my initials are on here. And then I'm going to bring this to the room. So when I enter the patient's room, I'm going to wash my hands. Hi Jenny, I'm Aubree. I'm going to be your student nurse for today. Hi Mom. How are you guys doing? Can I get your first and last name? Verify the name and date on the band. Sorry, the first and last name and then the date of birth on the band. And then let them know what medication we're giving it, why they're giving it, and any implications or side effects to look out for. Make sure that if the patient is too young to understand or any other situations, make sure the parents are aware of the medications that the patient is receiving. So I'm going to put on gloves so that I can check the patency of the IV that's already in the patient. Looking at the patient's arm, I just want to make sure there's no infiltration, no redness or anything. And then I'm also going to flush the line just to verify patency. So I'm going to, using friction, I'm going to clean the port for 15 to 20 seconds. So 15 to 20 seconds. And then let it dry for 15 to 20 as well. So after 15 to 20 seconds, I'm going to attach the flush. About 3 to 5 milliliters of normal saline, and then holding resistance on the flush, I'm going to release and use a push-pause method so I don't feel resistance and the flush is going through. Okay, so I'm going to clamp it and remove it. Okay, so now I want to make sure that the flush and the med is good. So first I am going to remove the lines. Turn on. So that's in, and then I'm going to attach this to the patient. So I'm going to clean the port again. For 15 to 20 seconds and let it dry for 15 to 20 seconds. This would have a cap on it. I would remove the cap and then I would attach the line. Okay, make sure all clamps are closed because I'm not going to start running it yet. I'm going to grab my medication that I have, make sure it's hanging higher than the normal saline is, and I'm going to just flush the line, so filling the port here halfway, and then I'm going to release. Make sure I get some flow, make sure there's no air bubbles, and then I'm going to attach it to the port closest to the bag. So cleaning this for 20 seconds. let it dry for 15 to 20. And then attach the med. So all clamps are closed, everything's in, and then I'm going to make sure that I add up my medication as well as a 20 ml flush to put in. Make sure both of these are labeled and the IV tubing is labeled. Allergies have been checked and all of the 5 rights have been checked for the medication to be given. So say we have 250 mils here and I'm giving 50 mils of medication. I would want to set my volume here to 300 and my rate to 50 mils an hour or per ordered by the doctor, and then I would start the line and making sure all the clamps are unlocked, and then the patient would get the medication, make sure that they're tolerating it, there's no questions by the patient or the parents, and then I would document my findings.